Welcome to the Health Matters Show, hope and help for healing fibromyalgia and chronic fatigue syndrome, where I bring you the best information, the best tools for healing, and the greatest speakers and programs to help you achieve your goals of getting well. My desire is to help you live a healthy and happy life from this day forward. I'm Cindy Crawford, your host. Today we're talking about the main symptoms of fibromyalgia. You may need these for diagnosis, or you may need to hear them once again just to help you figure out this illness. The hallmark symptom is chronic muscle pain. This can show up as a burning, stinging pain in the muscles, or more of a spasm or tightness, but it's certainly in all your limbs, and particularly throughout your legs, back, and upper shoulders and arms, upper back, back of the neck. We'll show this next when we look at all four quadrants of the body. This lady exhibits a common chart of the tender points of fibromyalgia. Now, if you hear the term trigger points, that may be more associated with myofascial pain syndrome. With fibromyalgia, we talk about tender points. They're clustered in the back of the head, between the shoulders and the top of the shoulders for the majority of the symptoms. But they can also run down the front sides of the neck and even into the upper chest. There can be a lot of pain associated in the upper parts of the body. The other main area is the upper and sides of the hips. You can see a lot of numbers there around this lady's hips and buttocks and the back of her spine, toward the bottom there, even the SI joints. This is a very, very painful area. Many people also experience pain in the elbows and the knees. Moderate to severe fatigue is very common with fibromyalgia and decreased energy. You just don't feel like doing anything. But if that fatigue gets too severe, you may also gain an additional diagnosis of chronic fatigue syndrome. Most everyone with fibromyalgia experiences sleep dysfunction. Some type of insomnia is common. Trouble going to sleep, staying to sleep, waking up, sleeping too little, sleeping too much, or actually getting a sleep diagnosis of sleep apnea, restless leg, or periodic limb movements. It's very important to designate and get a handle on these symptoms of fibromyalgia, because if you don't get your sleep dysfunction under control, it's very difficult, if not impossible, to heal from fibromyalgia. Many people experience stiffness upon waking after they've been in the bed in that terrible night trying to get some rest, or if they've just been sitting too long in a comfortable chair, or even napping. Fibro fog is a very difficult symptom because you have trouble remembering. Short-term memory, medium-term, long-term memory, it can all be involved, and you're not losing your mind. This is a symptom. Also, trouble concentrating or performing simple tasks, like driving down to the corner grocery store. Suddenly you're getting lost. No, you're not losing your mind. This is a very common symptom. But take your precautions and get help as you need it to live your life safely and as best you can. Many people experience tension or migraine headaches. This can be a symptom all in itself, or it can be involved with TMJ. Now that's temporal mandibular joint syndrome, which is not just simply jaw or facial tenderness. It is an exacerbation and a diagnosis all its own, but these are very common symptoms. You may be sensitive now to odors that didn't used to bother you, lights, bright lights in particular, noise, medications, foods, temperature and weather changes like cold. Many people in the summer can't take the cold air from an air conditioner or a fan blowing on them. In the winter, it's more temperature changes and barometric pressure changes. All of this can be so bothersome. But if you have a lot of sensitivities and this is an overwhelming symptom, talk to your doctor because it may be multiple chemical sensitivity. Other people feel more anxious or depressed. And who wouldn't feel a little down and a little anxious at being so sick? However, if this gets to be a significant problem, consult a medical or psychiatric professional because you may need help in managing this symptom until you can get better. You may have numbness in your arms or your legs. Some people have dizziness and actual nausea from low blood pressure problems or as a part of irritable bowel syndrome. This is quite common. When all these things are combined, you can feel pretty bad because irritable bowel certainly has lots of symptoms of its own, both an overactive and an underactive colon and heartburn, all kinds of things. Your bladder may have become irritated. Don't become too concerned. This is a problem unless it continues, then talk with your doctor. And certainly exercise, where you don't want to be deconditioned and you don't want to lose your muscle tone. You want to get back into exercising, but it can be very tough. So just be extremely aware, very mindful of your body so that you don't experience too severe a problem, because you're going to have reduced tolerance to exercise. That's quite appropriate for this stage. And afterwards, you may have muscle twitches, weakness, and certainly more pain. You may have skin complaints, such as when someone rubs up against you, it may hurt, or if they touch your legs. Many women's legs are very sensitive to pain. Your feet and hands may even feel like they're swelling, and they're not. Weight gain is a very common symptom with fibromyalgia. And this can be just part of the illness, or it can be as a side effect of medications you're on. So if this is a significant problem, check with your physician who prescribed the medications. You may have painful menstrual periods, urinary and pelvic problems, and even a hormonal imbalance problem. Now, certainly the first couple of symptoms there were for women, but hormonal imbalance can even affect men. Also, trouble breathing and vision abnormalities. Well, these are the main symptoms associated with fibromyalgia. I know it's tempting to stay curled up on that couch with a cup of tea and an Afghan, but you can't do it for too long. You'll get deconditioned, and it'll be that much tougher to come back from this illness. This concludes our broadcast today for the Health Matters Show. Thank you so much for joining us. Please find us on the web at health, H-E-A-L-T-H, matters, M-A-T-T-E-R-S, show, SHOW.com, where we provide you lots of information about fibromyalgia and chronic fatigue syndrome. We know you want to get well. Thanks so much. I'm Cindy Crawford, your host.